when a woman has a lesion in her breast, maybe she feels it, or maybe she's going in for screening, what happens? She ends up going and they recommend a biopsy. So they go and they do a biopsy, usually by ultrasound. And so then the patient has a biopsy and then they have to wait days or weeks, and then they get a diagnosis. And let's say at that point the diagnosis is cancer. Then the patient has sent to another doctor to see, well, do they need a treatment, do they need chemotherapy, do they need surgery, all these type of things. But what if we could go and we could do it all at once? The patient comes in, we see the area that's suspicious, we go ahead, we treat it while we're sampling it. So we've already definitively treated that lesion, and then we know later, okay, this is a cancer, these are the receptors, these are the genetics. If the cancer ever spreads and we need to treat it, we can, but we've already treated it at the same time while we biopsy it. We're not biopsying, disturbing the tumor and allowing that thing, because we know that when you biopsy these tumors, you inflame them and there's a potential for increasing to spread. I know they don't really want to discuss that, but this is what's been shown. And when you biopsy and you leave a tumor for a long time and before treatment, that increases the risk that the cancer is going to spread. So what if we just do it all at once? This is the way that I want to treat cancer. I want to have the patient come, we make the diagnosis, the treatment, everything all in one shot, and that way we can get much better treatment for the patients. And of course the other thing is that this is something that you don't have to cut off body parts, you don't have to give patients all these chemotherapies, you don't have to do all these other things. It's a much better treatment for the patient. This is the future, but this is possible now.